Hey there, and welcome to the Vegan Gym Podcast. I'm joined by my co-host, Dr. Daphne Bascom. My name is Leif and today we have an important topic. As usual, we always strive to have important topics on this podcast. So, Daphne, what are we chatting about today?
We are talking about, we're following up to our conversation around body composition and talking about visceral fat.
Awesome. So yeah, lots of people maybe don't know the differences between types of fat, and they just think, hey, the fat is what I can squeeze under my fingers that surrounds my abdomen, and I wish I had less of it. But what are maybe some different types of fat, and how does kind of visceral fat play into that equation of how you are gauging your kind of overall body fat composition?
Well, that's a good question. And there are multiple different types of fat. And I'm probably not going to get into all of them, but think about kind of white fat, brown fat, and I don't want to say yellow fat, but we'll call it visceral fat. Brown fat is a less commonly known type of fat, and it's the fat that's high in mitochondria. It's very energetically active. And I'm remembering from my physiology classes correctly, it's probably more prominent when we're younger, and we lose it as we grow older. And the residuals are going to be more around our thymus gland in our chest and things like that. So brown fat we generally don't see, but it's there. We have the subcutaneous fat, which is the stuff that you pinch when you go to pinch an inch. And that's the fat that most of us think of when we think about fat. So the fat that you can see that's under your skin, that's visually, that you can see visually, is what most people commonly think of fat. But there's a more insidious type of fat, which is called visceral fat, visceral, and it's the fat that's in your abdominal cavity that surrounds your body organs.
So what should I be thinking about when I hear visceral fat, when I hear visceral adipose tissue? What thoughts should come to mind?
The thoughts that should come to mind with visceral fat. So one, viscera is kind of what we refer to in terms of the stuff in your abdominal cavity. Those are your visceral organs. So when you're thinking about that, think about belly fat. So if you are over time noticing that your pants are a little bit tighter, that you have to loosen off, the number of holes on your belt, you're going from 4 to 1, that you're getting a little bit more of a rounded belly or a pooch, that may be not just subcutaneous fat, that could also be visceral fat. So it's the fat that is, I think about it more abdominal centric fat.
And this is something that visceral fat has some health risks associated with it. So What are those specific health risks that we should be concerned about?
So the fat under your skin is it's metabolically inert. It doesn't secrete hormones. It doesn't secrete any chemicals. It's not healthy, but it's not as unhealthy as visceral fat. Visceral fat is more commonly associated with conditions such as metabolic syndrome, type 2 diabetes, and a high visceral fat is more commonly correlated with health conditions that we need to take action on immediately because it contributes to insulin resistance, it promotes inflammation, and it can also alter lipid metabolism. So when you're thinking about your cardiovascular and your metabolic health, thinking high numbers of visceral fat or having significant amounts of visceral fat is less healthy.
So let's quantify that amount of fat. What is an unhealthy level of visceral fat?
I'm going to answer that question in 2 ways, and I'm also going to expand on it a little bit. One, I can't look at you and measure your visceral fat. So you either need a proxy measure or you need to have it measured directly. We have been talking about measuring it directly using things like the DEXA scan, and where you can actually quantify either in volume or weight what may be the volume of fat that you have surrounding your abdominal organs. Based on population data, the average will vary based on age. You can also stratify it based on, I'd say, percentages for, over a bell curve, even within that age range. You want your visceral fat, the fat within your abdominal cavity, to be less than 1 pound. And this is Daphne's generalization based on what I've been reading in some of the literature. The numbers vary. You may actually see at a younger age, it may be lower. There tends to be a higher level of tolerance for what's in the norm as you grow older. But if you wanted a target to be less than, let's say less than 1 pound. So we were talking about looking at our DEXA scans, 0.2 pounds, 0.1 pound. Those are all low numbers. And my advice is to get it as close to 0 as possible. That would be the best recommendation. The indirect way of looking at your visceral fat is actually measuring your waist circumference. So if you don't have access to a DEXA scan and you can't directly measure the fat that's in your abdominal cavity, you can indirectly determine whether you have abdominal obesity by just getting out a simple tape measure. So if your waist circumference exceeds around 35 inches for women, 40 inches for men, or if even one step further, your waist to hip circumference is greater than 0.85 or 0.9, then you probably have abdominal obesity, and you most likely have a significant amount of abdominal fat or visceral adipose tissue.
0.85 for men and 0.9 for women?
Yep.
So if I wanted to, so that's a great, kind of inexpensive way of getting some general idea of whether I might have unhealthy levels of visceral fat. If I wanted to get a really specific number for the amount of visceral fat that I have, what would be some good options of testing that?
There are 3 tests that come to mind. One, the DEXA scan, the dual X-ray absorptimetry scan, is one way of looking at your body composition, and the results from that scan will give you most scans. And I'm qualifying that because if you're scheduling a DEXA, make sure that the provider that you're scheduling it, that you're booking that appointment with, that their device and their software can actually calculate VAT. Because not every, and you may see it qualified on their website saying, we cannot do visceral adipose tissue at this location. So that's the first thing. You can get it from a DEXAFit, a Fitnicity, any of these organizations that do DEXA scans for body composition. A CT scan or an MRI scan are also less accessible but highly accurate ways of quantifying your visceral adipose tissue. And I'm seeing more about MRI scans in some of the literature related to health and fitness, but I've never had an MRI scan specifically for body composition myself, but those would be 2 other highly quantifiable means of looking at your visceral adipose tissue.
As a little bit of a tangent, is there, for an MRI scan or a CT scan, are there different ways of setting that up to measure different things, or any time that you get an MRI or CT scan, they would have access to that body composition information?
Leif, that's a good question. I do not believe that there's a special setup that's needed. So if I can rephrase that, if you had a full abdominal scan, would they be able to quantify your visceral adipose tissue? I would say yes.
Yeah, if I just got it for some other health reason.
I don't see why not, but I want to say yes, but I can confirm that. I don't believe that there's no special software or hardware that's needed. It's mainly looking at using the density of the soft tissue, the fat in your abdomen, and then looking at that volume. And that should be quantifiable from any CT or any MRI.
Very good. All right. So now we know a little bit more about what visceral fat is, how we measure it, and some risks associated with it. So let's talk more specifically about metabolism and how does visceral fat affect your metabolism, and what makes visceral fat more dangerous than fat that's stored in other areas of your body?
Visceral fat is, even though I'm looking at this fat on the table and it's inert, visceral fat is metabolically active in that it releases fatty acids, it releases hormones, it releases inflammatory molecules. And as a result, what it can do, if you're thinking about your metabolism, it can impact your body's sensitivity to insulin. Insulin is the hormone that is used to remove glucose out of your bloodstream into your cells. It can also, high levels of visceral adipose tissue can also impact your body's lipid levels. So it correlates, high VAT also correlates with potential for dyslipidemia, meaning you may have a higher LDL, higher triglycerides, lower HDL. All of those may also be tied into being less metabolically healthy. And it's a secondary effect of both your decrease in your insulin sensitivity and the types of inflammatory molecules that are released by your visceral adipose tissue. Those are the main ways that visceral adipose tissue affects your metabolism.
Yeah, so definitely not ideal for a host of different reasons to have higher levels of visceral fat.
No. So, and let me be clear, higher levels of visceral fat contributes to a higher risk of chronic diseases. So if you're thinking about type 2 diabetes, if you're thinking about metabolic syndrome, if you're thinking about cardiovascular disease, there's a definite correlation between those chronic diseases and individuals that have a higher mass, total volume of visceral adipose tissue.
And what about kind of stress and its impact on visceral adipose tissue? Like, what are some of the factors, maybe stress and others, that really are going to affect whether I am storing additional energy as visceral adipose tissue versus other fat?
So let's talk about chronic stress, because acute stress, we always, I think, tend to vilify cortisol as being bad. And cortisol isn't always bad. So if you have an acute stress, your cortisol level may go up, it comes down. But when you're chronically stressed, you may have elevated levels of cortisol, and those elevated levels of cortisol can promote the storage of visceral adipose tissue, so abdominal fat. So to answer your question, the things, stress, lack of sleep, poor nutrition, lack of physical activity, they are all correlated with tending to have a higher level of body fat, and they also correlate with the potential of having a higher level of visceral adipose tissue. And the important thing is that those are all things you can control. So I'm not saying this is genetically programmed. What I'm saying is your nutrition, your movement, your stress management, those are all things that you can manipulate or manage so that you can prevent visceral adipose tissue from developing. Or if you know that you already have significant abdominal obesity and that your visceral adipose tissue is high, what interventions can you take to lower it.
I always find it so empowering that we have it within our control to transform any part of our bodies
We do.
and our health, our fitness, our physical ability. And it always just reaffirms the importance of those kind of top mechanisms that we have at our disposal: sleep, stress management, diet, exercise, and really all facets of your health: visceral adipose tissue, your potential for developing any kind of chronic disease, your body composition, really just across the board. All health metrics are in one way or another tied back to the controllables.
I think they are.
And I think that's really empowering.
And it's funny because I was traveling yesterday and people watching in the airport, and even the gentleman sitting next to me on the plane who had a significant belly. Many of these chronic diseases don't manifest until you're symptomatic. So you don't know that you have high blood pressure until you do. Prediabetes, you don't know that you're pre-diabetic until it's measured and you find it out. Insulin resistance is something that, prediabetes is kind of a midpoint toward type 2 diabetes, but that insulin resistance is something that's developing over time. So all of these things, it's not like they just happen overnight. It's an accumulation, an aggregation of kind of insults to your body over time. But at any point in time, you can intervene.
Yeah. And I find that really empowering. And I wish more people knew that you don't need drugs. You don't need kind of traditional healthcare outside of, or at least that's not the primary driver for making changes to your health. And just the fact that you have it within your power to be able to completely transform your body and health is, I think, a really important message that more people need to be practicing in their life.
But the same levers that prevent also treat. So when you're thinking about nutrition, so again, we're talking about visceral adipose tissue, but all of these apply to improving your overall body composition. So reducing ultra-processed foods, eating more whole foods, they'll help your body composition, they'll help your visceral adipose tissue. Being physically active, moving, gaining muscle will help improve your insulin sensitivity. Muscle's metabolically active in terms of, raising your metabolic rate. That will help reduce your risk of chronic disease. Sleep, lack of sleep is related to increasing your cortisol too. So sleep and stress, I frequently talk about them together because sometimes they're correlated, but lack of sleep is another factor that's under your control. If you're sleep deprived, your cortisol is up, which can also impact how your body manages fat storage. It also impacts your hunger hormones. So your ghrelin will increase. I think of ghrelin as gobble, in which
yeah.
So the munchies you get when you're sleep deprived, your leptins decrease when you're sleep deprived. Those factors also contribute to the decisions you make that can contribute to your obesity.
Yeah, sleep solves a lot of problems.
Oh my gosh, yes.
It really, yeah. The more I learn about sleep, the more I just elevate its importance in my own health and fitness journey. So let's talk in a little bit more detail about hormones. So how do hormones play a role in the storage of and reduction of visceral fats? I think this is especially a crucial conversation for women who are going through menopause. I think this is a common experience. So what are your thoughts on the effect of hormones in storing and reducing visceral fat?
So hormones play a crucial role. in the storage and reduction of fat. And we've had a lot of conversations about this in the Menopause Mastery course because estrogen, and I love her, but she helps regulate fat distribution. And so when we're talking about changes in estrogen levels, meaning as we move through life, our estrogen levels will decline. That decline in estrogen level is associated with how our body redistributes fat. So during our premenopausal years, we tend to have higher levels of estrogen and more fat around our hips. Women, as they go through perimenopause and menopause, may actually have several changes going on. One, an increase in abdominal fat, which may also, not just abdominal subcutaneous fat, but abdominal visceral fat. They may also experience a little bit of a dyslipidemia, meaning that their LDL may go up, their HDL may go down. So their balance of healthy and less healthy hormones may also change, which can contribute to their overall health. So in women who are going through midlife changes, I think that there's also probably a change in insulin sensitivity that also occurs as estrogen levels change, which can compound our ability to manage our glucose levels and manage our metabolism. And then probably the other thing in particular with women relates to stress and sleep again, and the cortisol levels and managing the cortisol levels. So high cortisol, low estrogen tend to create a milieu that promotes fat storage, and it creates an environment where you may see an increase in your visceral fat.
So what can women do to really set themselves up for success as they kind of go through menopause and beyond when it comes to storage of fat and just really ensuring that they can accomplish whatever maybe fat loss goal they have or just body recomposition goal they have?
Women and men. So I don't want to exclude men from the conversation because some men at a younger age may have a significant amount of visceral fat. And you tend to see that as kind of I don't want to say the middle-aged middle, where you start to get a little bit of your abdomen rolling over your waistband. Whether we're talking men or women, the key things, again, are going back to lifestyle. So there's no magic pill today that you can take. It's not hormone replacement therapy that's going to solve your weight management issue. It's not, yes, there are many drugs that are coming out, like Ozempic, that can help with weight management. And these are powerful options for people who need them. I still want to advocate that the biggest things that you can do are to focus on your nutrition, your physical activity, your sleep, and your stress. Because even in an environment where you're taking, whether it's Wegovy, Ozempic, these glucagon-like peptides, whether you're using any type of adjunct to support your weight loss journey, you ultimately need to adopt lifestyle behaviors that you can sustain that will allow you to maintain that weight and that body fat level over time. So what I encourage women to do is, one, to find, you can't change everything. So don't think you're going to go out and solve world peace and I'm going to change my nutrition, I'm going to start exercising, and I'm going to sleep 10 hours. And you need to first start with one thing that is in your control to change, and use that to make an impact. If it's adding more plants, let's start to do that. If it's removing ultra-processed foods, let's start to do that. There are a lot of little things that we can do that make a difference, that are within our control, that don't require a prescription. They don't require an injection, and they don't necessarily require you to do something in addition to living your life in a healthful way.
Well said. let's dive into nutrition a little bit more detail to kind of wrap things up in our conversation on visceral adipose tissue. What kind of nutrition strategies can anyone practice to set themselves up for low visceral fat levels and ensure that their body, from a body fat perspective, is as healthy as possible?
So I may be biased, but I'm going to say whole food plant-based is going to be one of the healthiest ways of eating that you can adopt. If you are an omnivore, adding more plants to your plate, so crowding out the animal protein and adding more plants is a definite way to improve the balance of all of the healthy benefits that you get from being plant-based. So whole food plant-based, reducing ultra-processed foods, reducing your intake of refined sugars. So again, a lot of the foods that we are ingesting today they're overly processed. And reducing those can have a significant impact alone. Reducing your alcohol consumption is another. Not, I am not someone who drinks, so I'm not saying this as a judgment statement, but your metabolism and your sleep and many other things will be better if you choose to drink less or drink not to drink than if you consume significant amount of alcohol. And alcohol consumption, there's a definite correlation between alcohol consumption and visceral fat. So less in this case is more. So cut back on the ultra-processed foods, cut back on the refined sugars. Whole foods are best. Reduce your alcohol consumption are the main things from a nutritional perspective that you can do positively to reduce not only your visceral fat, but your overall body fat.
Yeah. So if I want to just have kind of one main lever to pull to reduce my visceral fat levels, it's going to be highly correlated with a reduction in my total body fat levels. So I want to lose body fat. So if I'm looking at how my diet is structured, yes, everything that you just said is really important and healthful. But if we are going to determine how to structure a diet from a calorie perspective, we would optimally be ingesting fewer calories than we are burning, maintaining a calorie deficit, working to lose some body fat. And with that can come a reduction in your visceral fats.
Correct.
And then once you get to kind of a leanness that feels really good for you, then you can get another body composition test on, assess where you are with your visceral fat levels. If your body fat has gone down, your visceral fat should have gone down in step with that. And ideally, you get under that 1 pound threshold where you have healthy levels of visceral fat. And if you can get down even lower than 1 pound, even better. But that is not just good from a body composition perspective, losing body fat, but it can also help reduce this metabolically active, potentially harmful fats that is visceral fat.
It not potentially harmful. It is not healthy. That is substantiated in the literature. So yes, agree with everything you said. The only addition to that would be that there are instances when you can look thin outside, but still have visceral fat. So don't necessarily assume because you look externally healthy that you are metabolically healthy. I agree with everything you said in terms of how to get to a healthy body fat. Being in a calorie deficit is definitely the way to do that. Achieving that goal will get you to a healthier visceral fat. But I also I don't want to look at the outside of the book and assume I know what's on the pages. if you don't have the healthiest diet or you have unhealthy behaviors, you still may not be metabolically healthy.
Well said. Do you have any other thoughts on visceral fat that you like to share?
No, I would encourage everyone listening that, regularly monitoring your waist circumference at a minimum. If you're able to get to a DEXA scan or some other way of actually having a quantified assessment of what your visceral fat is, it's always nice to know what your baseline is and then understand what you can do to improve it over time. If it's someone like you and it's close to zero, no need to worry, but understand your body composition holistically and then make the necessary interventions needed to improve it.
Wonderful. Well, thank you so much, Daphne, for sharing all this important information about a type of body fat that most people probably don't know too much about. And yeah, it's important information, and really appreciate you sharing it with all of us.
Thank you. Appreciate it.
I hope that you enjoyed listening to this episode of the Vegan Gym Podcast. Please be sure to subscribe if you enjoyed listening to this. We also have been posting most of our episodes recently on YouTube, so you can check us out by searching for the Vegan Gym Podcast on YouTube. Thank you so much for listening to this episode or watching it on YouTube, and we look forward to seeing you in the next one.